Dental x-rays are needed to be able to do a proper diagnosis. This is an 80-year-old man who has had a lot of work done. You can see some of the gold work that he had done about 50 years ago. And you can see some of the stress fractures. And here's an x-ray that was taken in 2010. And it might have been possible to see if there's something there, but truly there was no pain. And he's been very faithful in getting his teeth cleaned, but has consistently said he didn't want to have any x-rays taken. So when you look at a tooth on just a diagnostic basis, it's very, very difficult to see what's going on. You can see the little chalky area there on the number 20, the premolar, but that doesn't really look like a cavity. And over time, he had gotten quite a lot of bacteria and food caught in there. And you can see the gum tissue being a little irritated. Here's the onlay as well, or inlay onlay. And all of his work and the gold work has been done maybe 40 to 50 years ago. Now, here's number 20 enlarged, and you can see the hole or the cavity that was there. And on normal magnification, that would be very difficult to see initially. And when we saw it in the office, we recommended having the x-ray done. And when we actually look at the x-ray, it turns out that this is a really large cavity. You can see in the x-ray here the extent of what's there just from the x-ray, but x-rays only show 70% of the actual decay. Now there's many other things going on in this patient's mouth, and you can see some lower fillings that were done, and he consistently gets tartar down in that area. And much of the very fine gold work that he has had done is held up very nicely, very conservative. It's worked out very well and is really considered one of the best restorations, other than the fact that aesthetically it doesn't look so good. And it's going to be a challenge for the materials today to last as many years as these particular restorations. Only time will tell, but for a fact, the gold restorations with good hygiene lasts a long time. Here are some more of them. You can see the smooth margins, a little bit of wear on tooth number 30 because the margin didn't come over the edge like it did on 31. It's usually a better idea to cusp or have the gold extend there. Here are some tooth colored fillings that are probably about 10 or 15 years old. They're highly polished and they're smaller fillings, so you don't need to have that type of extensive work. The fact that he's worn down a lot of his teeth. Now there's a loose tooth there, and you have to ask yourself, well, why is there a loose tooth? And he has been a consistent grinder of his teeth, and over the years, he's worn down just a little bit of the edging, but if he had been wearing a night guard or something to protect his teeth, he wouldn't have as much of a problem in terms of the actual bite. And when we look at the x-rays, that's a 3-unit bridge there that was put in about 5 years ago. And when we look at the x-rays, you'll see that that upper right area is compromised as well. No movement on that premolar. We're just double checking to make sure everything is good that way. Here's the upper left bridge, a little bit of gum recession, which is not uncommon. You can see the margin on the abutment tooth there, and It was purposely placed a little bit higher for cleansability. There was a crown done on the lower left where there's a little bit of a patch because the patient has a very hard time getting back there and getting it cleaned. You can see kind of the whitish area, and then part of the filling is that brown area that went over it, and that's slowly dissipating. Here's the upper right side again, and you can see all the recession that the patient has. Oftentimes that's and tooth number 3 doesn't move, and you can see how tooth number 4, I just moved that. And oftentimes when someone is brushing too hard in a particular area, if your favorite area is the upper right in this case, you'll cause more recession. And there's a video on gum recession. Here the patient is going back and forth, and you can see how tooth number 4 is being involved when he grinds his teeth. And every time he's sleeping at night, he may not be grinding, but he's doing it enough to cause the looseness that's there. The other side, he's just more or less sharpened the teeth, but hasn't actually caused any mobility. Here are some of the x-rays. Again, seeing the tooth number 20, that's number 18. There's the margins that are smooth on that lower right. You see the composite fillings that are up on top. And that's it.